The state's budget cuts have already had an effect on Montana's most vulnerable citizens, those with mental health disabilities. KXLF's John Amy talks with a mental health service in Butte to learn how the agency is trying to deal with these cuts.
About 2,000 people in Butte rely on Western Montana mental health for services, but the nearly $4 million in budget cuts from the state have greatly impeded that service and caused layoffs.
Approximately at this time 40 people. We've also had closures of our Dillon office as well as our Libby office.
The Butte office has been able to retain its more than 100 employees by making some program changes, but there has been an almost 3% Medicaid rate cut in all its services and 50% cut in its case management services.
You know, people in Butte will have to go outside of their area to get services, whether it's children's services, whether it's adult services, to see a prescriber. And so it's important that we have sustainable services here in our communities.
Officials say when mental health services get cut, the public ends up paying for it anyway, because the folks that need this service find it at the emergency room or even here at the Butte jail.
If you look at as far as cost of care, that's a very high cost of care, is either housing somebody at the jail or having somebody in the emergency room. It's a pretty significant amount.
And this agency is still waiting on the governor's final budget, which could include more cuts. A difficult thing for those working in mental health services.
It creates angst in people and stress. And so I think that's been really tough on employees.
And clients. In Butte, John Amy, MTN News.
Thank you, John. The state has not released its final budget, so mental health officials don't know how much more will be cut.